system is? Oh no, it is the endocrine system. The endocrine system is a signaling system that works in conjunction with the nervous system to control and regulate the body. In contrast to the nervous system, which uses electrical signals to affect this, the endocrine system communicates using chemical signals called hormones.
Okay, so now it is very important. The central nervous system definitely consists of the brain and spinal cord, right? And central nervous system work with endocrine system, and central nervous system control or regulate to secretion of the hormone from endocrine system or endocrine gland. If I say what is hormone? Hormone is a chemical substance what is secreted from endocrine gland and transmitted to the body without any particular pathway, or they transmitted through the blood.
These hormones are used to control growth and development, metabolism, reproductive processes, and even affects our mood.
So you see, endocrine system control our development, like your growth. It is control metabolism. You know, metabolism is a chemical reaction occur inside the liver and produce energy. Endocrine system also play important role in our reproductive system. Reproductive system is very important, right? Man, female, and our maintain our generation. Even also the endocrine system is play an important role to stabilize our mood. So psychological effect as well.
Hormones are produced by the endocrine glands and ends in the bloodstream, where they circulate around the body. They are key to specific tissues, and once recognized, they signal the tissue to perform a task. Due to the rapid and brief nature of nervous impulses, endocrine signals are relatively slow and act for a prolonged period.
The endocrine system has many glands. These glands make hormones that control the functioning of the endocrine system. Oh, take it easy, my friend. I'll explain it to you in detail. You see, our body has many.
So in this picture, as I told in my last when we discussed the pituitary gland, which is the master of gland, they can control everything. Like pituitary gland secrete the thyroid stimulating hormone, and thyroid stimulating hormone work on the thyroid gland, and thyroid gland secrete T3, T4, and also another two pairs of gland called parathyroid gland. They secrete calcium or maintain the calcium and phosphorus. They secrete parathormone. Two small gland just top of the kidney is called suprarenal gland. They secrete androgen, glucocorticoid, mineralocorticoid. They are sex hormone, also androgen or glucocorticoid. They're important to maintain the electrolyte balance in the body. And pancreas, another important gland, but they are exocrine and endocrine both nature. They secrete insulin, glucagon, and also pancreatic enzyme. Pancreatic enzyme is important to digestion the protein, but insulin important for maintain the blood sugar, and glucagon also important to maintain the blood sugar. And also there are testes, which is secret testosterone for man, and ovaries, which is secret estrogen in case of female. So all of this is controlled by the endocrine gland.
Many small organs called glands. These glands together make up the endocrine system. Each gland has a special job. Let me introduce you to your glands. First, meet the pituitary gland, the boss of all endocrine glands.
The pituitary gland is about the size of a pea and is known as the master gland because it regulates all the other glands and tissues that comprise the endocrine system. It is located at the base of the brain and is connected to the hypothalamus, which in turn regulates its activity. It is part of the nervous system located in the diencephalon or interbrain. This is where the nervous system and the endocrine system shake hands as it works. The hypothalamus is involved in the control of our body, temperature, emotions, and sexual activity.
So here you know that two most important, one is the pituitary, other is the hypothalamus. So hypothalamus basically maintain the body temperature, our emotion, and sexual activities, right? Hypothalamus. So here is important one point I want to share with you. The hypothalamus, I mean NCLEX board, sometimes ask the question, NCLEX board asks the question, I said, body temperature maintained by which gland? Hypothalamus. Our mood is switching by which gland? Or mood change, emotion control, depression, mania, anxiety, hypothalamus. Also the sexual behavior, even activity, how you think about or during the sexual activities, right? So many people depends on the medication for sexual activities, but you do not need to depends of medication for sexual activity if you know how to control the hypothalamus.
Among many other things, these activities are initiated by the hypothalamus based on negative feedback. The hypothalamus accomplishes this in three ways. 1. The hypothalamus regulates the anterior pituitary gland by stimulating.
So hypothalamus regulate anterior pituitary also. So, and you know the pituitary gland has a two section, anterior pituitary and posterior pituitary. Anterior pituitary secrete some of the hormone like FSH, follicle stimulating hormone, growth hormone, LH for luteinizing hormone, and TSS means thyroid stimulating hormone, and parathormone. All secret for anterior and posterior pituitary is here. They secret also like prolactin, oxytocin, then ADH, all.
Stimulating or inhibiting the production of the pituitary hormones. 2. The hypothalamus releases hormones directly into the circulatory system through the posterior pituitary gland. And 3. The hypothalamus controls the endocrine cells up to the adrenaline medullae, which produce a very important hormone called adrenaline. The pituitary gland has two lobes, the posterior lobe and the anterior lobe. The anterior pituitary gland is connected directly to the hypothalamus by a capillary network called the hypophyseal portal system. Two types of regulatory hormones are produced by the
Here is telling about the blood supply. We do not need this for NCLEX board exam.
hypothalamus and transport it directly to the anterior pituitary gland, releasing its hormones and inhibiting hormones. These hormones in turn regulate the production of hormones by the anterior pituitary gland. The hormones produced by the anterior pituitary gland include thyroid stimulating hormone or TSH, that triggers the thyroid gland to secrete thyroid hormones.
So this is showing here the pituitary secrete the TSH. TSH stands for thyroid stimulating hormone. The TSH work on the thyromas or thyroid gland, and thyroid gland secrete T3 T4. When T3 T4 is less, we say hypothyroidism. When T4 and T3 is high, hyperthyroidism. But basically T3 T4 is controlled by TSH, and TSH is controlled by the pituitary.
The adrenocorticotropic hormone, or ACTH, that stimulates secretion of hormones in the adrenal glands. The follicle-stimulating hormone, or FSH, that stimulates sperm production in the male testes, as well as it stimulates estrogen hormone secretion and egg development in the female ovaries. The prolactin, or PRL, that stimulates the formation of mammary glands in the female and the production of milk.
So you see what we has to learn here? Prolactin. So prolactin is a hormone what is produced the milk when mother during or after the delivery, right? So after delivery, baby needs the feeding, milk feeding. So that times this gland is secreted the milk, right? So it is related to the other factor as well. So prolactin stimulates the formation of the mammary gland in the female and also production of the milk, right? But keep in mind another terminology. In case of men, if any man chest look like a breast, this is galacto. It is called
The luteinizing hormone, or LH, that induces ovulation in females and stimulates estrogen and progesterone hormone secretion in preparation for pregnancy. It stimulates the production of testosterone hormone in the testes. And the last one, the growth hormone, that targets cells in the liver which are involved in processing food as well as stimulating cell growth and replication throughout the body.
Next one is the posterior pituitary gland, which contains neuron cells that originate in the hypothalamus, and it releases two hormones that are produced in the hypothalamus. The antidiuretic hormone, or ADH, which targets cells in the kidney.
You see, posterior pituitary secreted ADH, but ADH work on the over the kidney or suprarenal gland. So antidiuretic hormone that targets cell in the kidney and work maintain the proper balance of electrolyte in the bloodstream. So in NCLEX board, if asks you question, what the name of the hormone maintain the electrolyte balance is called antidiuretic hormone, shortly ADH. NCLEX board question is simple like this and is very important.
And works to maintain a proper balance of electrolytes in the bloodstream. And it is also involved in maintaining proper blood volume and proper blood pressure. The oxytocin, which helps prepare the uterus during the last stage of pregnancy for labor and delivery. It is also involved in producing milk in the mammary glands. Next comes the thyroid gland, the growth agent, together with the parathyroids.
There are 4 parathyroid glands located behind the thyroid glands.
Okay. This is the thyroid gland, posterior view, right? In the posterior view, there are 2 small glands This is called parathyroid gland. Sometimes in like a patient has a tumor in the thyroid gland, when the thyroidectomy is done, the surgeon fortunately or unfortunately remove this gland and make a problem. So as a RN, what is your responsibilities? Your responsibilities after the any kind of thyroid surgery, you have to monitor for the patient for any kind of involuntary movement of the body, right, or muscle, involuntary movement of muscle, and this is called seizure. Why seizure is important to monitor? Because this gland, parathyroid gland, secrete parathormone, and parathormone is important to maintain the calcium and phosphorus level. Because of imbalance of calcium, patient develop involuntary movement of muscle, and this called seizure. So after the thyroid surgery, if you see patient has a seizure or involuntary movement of muscle, means the surgeon unfortunately remove the parathyroid hormone as well. So if the patient has this type of accident, they has to take the lifelong parathormone tablet, right? So very important.
Parathyroid glands monitor and controls the amount of calcium in our blood and
So they said they maintain the calcium in blood, and calcium and phosphorus is important component of bone. Yes. So if calcium is less, your bones will be weak. If calcium is more, it does not mean your bones is stronger. No. If calcium is more than normal, then also bones will be broken. So hypercalcemia also causes the broken bones. So you have to have the very equal, normal, or also equally distributed the calcium all over the bones, equal distribution.
bones by secreting a hormone called parathyroid hormone or PTH. Each gland monitors the blood calcium and responds by making more or less. Hyperparathyroidism is a disease of the parathyroid glands affecting.
So hyperparathyroid, so the real size of gland size is this, but in case of hyperparathyroidism, right, here showing they secrete more parathormone, I said. When more parathormone increase, their imbalance of the calcium and phosphorus occur.
1 of 800 people during their lifetime, and 1 in 250 women over age 50. Since parathyroid glands control the levels of calcium in our bodies, hyperparathyroidism is a disease of improper calcium regulation. Hyperparathyroidism is a disease that occurs when one of the parathyroid glands develops a tumor. This tumor produces more far too much parathyroid hormones, which is released into the bloodstream. The excess parathyroid hormone travels through the blood and into the bones. The hormone activated cells within the bones to eat away at the bones, often causing osteoporosis, fractures, and bone pain.
You see, so when deficiency of the calcium on phosphorus, the healthy bones look like this picture, and this is called osteoporosis. The osteoporosis patient bones will be weaker, thin, broken, and after a long time they will be shorter little bit, and is it easily fracture occur, delay to healing. Also, bone pain is most common.
The destruction of bone releases calcium into the blood. High blood calcium levels are seen in almost all patients with parathyroid tumor. The excess calcium can build up in the arteries, increasing atherosclerosis.
So this is another problem. Excess calcium deposit inside the arteries and narrowing, it makes narrowing the artery one of the component to develop atherosclerosis. So too good is not good, right? So here, if you eat all the time calcium and increase the calcium level in the body, it does not mean your bones will be going to get stronger. It means it excess amount deposits in the artery, blocking the artery and causes atherosclerosis.
Throughout the body. This can lead to high blood pressure and increased risk of heart attack and stroke. The high calcium often affects the electrical system of the heart, causing atrial fibrillation and palpitations. The excess blood calcium builds up in the kidneys, forming kidney stones, and occasionally causing kidney failure.
So also excess calcium causes the kidney stone.
High calcium levels also affect the brain, since we use calcium in the electrical system of our nerves. A high blood calcium is associated with a slower nervous system, which gives symptoms of tiredness, memory loss, and poor concentration. Many patients with high blood calcium have chronic fatigue for this reason. High calcium levels have an effect of the stomach and the intestines, often causing gastroesophageal reflux disease, also known as GERD, and abdominal discomfort. High blood calcium is even associated with higher risk of several cancers, including breast, prostate, colon, and kidney, some of which are more than twice as common in patients with high blood calcium. It is estimated that untreated hyperparathyroidism can decrease a patient's life expectancy by 5 or 6 years, even when the calcium is slightly elevated. There are no drugs, pills, or other treatments that can slow the process of bone destruction or take the place of surgical removal of the parathyroid tumor. Hyperparathyroidism is cured by surgical removal of the parathyroid tumor. In the hands of an expert, parathyroid surgery is a straightforward outpatient procedure that can often be completed in less than 20 minutes. Since as many as 30% of patients with hyperparathyroidism will have more than one parathyroid tumor, your surgeon will examine all 4 parathyroid glands to be sure the second tumor is nothing left behind. Once all parathyroid tumors have been removed, the disease is cured. The process of eating away at the bones stops within minutes. Bone pain is typically gone within a few hours. The bones begin to regenerate within days, and the osteoporosis begins to improve. The excess calcium in the blood will be gone within few hours, and within a week or two, most patients feel significantly better. Risks of high blood calcium begin diminishing within days of parathyroid tumor removal. Hyperparathyroidism is a disease that typically makes people feel bad while it slowly destroys their body. All patients with hyperparathyroidism should be evaluated for a straightforward operation to remove the parathyroid tumor. Curing this disease has a tremendous impact on a patient's overall health. Right on top of the kidneys are the adrenal glands.
During periods of stress, such as preparing to run in a race, the brain signals the adrenal glands to produce epinephrine or adrenaline. Epinephrine increases the rate in which the heart beats. In turn, the increased cardiac output supplies more oxygen to the muscles.
So you see the epinephrine. So epinephrine or norepinephrine. Other name of this two is called adrenaline or noradrenaline. So epinephrine or norepinephrine, adrenaline or noradrenaline, both is increase the heartbeat, right? So increase the blood pressure.
putting the body in a heightened state to react. As a longer-term response to stress, cortisol is secreted by the adrenal glands, promoting the release of energy.
The next one is the pancreas.
As an example of how parts of the endocrine system works, consider the pancreas. In addition to aid in digestion, the pancreas also serves as an endocrine function which regulates blood sugar levels. High blood sugar causes the pancreas to release hormones called insulin into the blood. When levels of blood glucose or sugar become too high, the pancreas increases production of insulin. Chemicals in the insulin cause body cells to open up, allowing more glucose from the blood to enter cells, stabilizing the amount of glucose in the blood and maintaining adequate energy in the cells. When this reaches the liver, it signals the liver to convert sugar into glycagon for storage. This reduces the blood sugar levels, which reduces the stimulus of pancreas to produce insulin, and insulin levels fall. This slows down the conversion of liver and eventually stops altogether when optimum levels have been achieved. When blood sugars level fall, the pancreas releases another hormone called glycagon which stimulates the liver to convert glycogen back into sugar, and again restore the optimum blood sugar level.
When food is ingested, it travels along the digestive tract where it is broken down into its complete nutrients in order to be absorbed into the bloodstream. One such nutrient is glucose, a simple sugar. Glucose gets absorbed by the stomach and intestines and then enters the bloodstream. It travels to circulation to all body cells. Once absorbed into the bloodstream, glucose circulates, causing the blood sugar level to rise. An increased level of blood sugars sends a signal to the pancreatic data cells, which respond by secreting the hormone insulin into the circulation. Insulin is necessary for glucose to reach and be used by several important target tissues.
So my friend, blood sugar glucose is traveling through the blood, right? And this is the cell, and cell needs glucose. But if it is not easy to get them, right? So the cell, they are hungry for the glucose, but they do not take this glucose without insulin. So insulin is a media. They connected glucose and cell. So when insulin is bring them and glucose is metabolized inside the cell, and during the metabolism they produce the energy. But I said the insulin is very important factor to bring them for metabolism, or insulin is important factor to regulate the glucose, or insulin is the important factor to maintain the normal blood sugar. It is called glucose level.
Tissues of the body. These include the liver, muscle, and fat.
Okay, so you see, like you said, I hate fat, but you eat too much carbohydrate, right? If you eat too much carbohydrate and your physical activity is less, also glucose converted to the fat in the body. So glucose is majority taken up by the liver for metabolism. Muscle tissue also need glucose, and extra glucose deposit as a adipose tissue, fat.
Insulin is necessary to keep blood glucose levels stable in the body. Glucose enters the cell through a process called facilitated diffusion.
You see what going on? This is the receptor, right? When glucose is there, this is open up, and when inside, this is open here, and glucose come inside. So this is the intracellular, and this is the extracellular, or is it to? It is the blood. It is the inside the cell. When glucose is there, receptor open. When glucose inside the receptor, they close, and inner side will be open. And glucose taken and put inside for next level.
There are two types of diabetes, type 1 and type 2. Type 1 diabetes accounts for about 15% of all cases. It's most often found in the under 40s and is by far the most common type of diabetes found in
So
childhood.
this is the two type of diabetes, type 1 and type 2. Type 1 is most common in the children. So it is called juvenile diabetes. Or most of the type 1 diabetes found before 40 years old. So after 40, the diabetes is called type 2 diabetes. And type 1 diabetes, I said childhood, so it is called juvenile. And type 1 most of the times genetic cause. And type 1 is insulin dependent. Patient has to take the insulin. But type 2 is an adult. Patient do not need to, or patient first choice of medication is the anti-diabetic medication like metformin. If the anti-diabetic or oral hypoglycemic agent is not enough to control the blood sugar, then we can tell them to take the insulin. But basically type 1 diabetic is insulin dependent, but type 2 is non-insulin dependent and is also adult person.
In type 1 diabetes, the carbohydrate containing food is broken down into glucose as normal. That glucose then moves into the bloodstream. Normally, the body would produce insulin to let that glucose into the cells. But in type 1 diabetes, there is no insulin being produced, so the glucose can't get through the body cells at all. So the level of glucose in the blood rises and rises. The body tries to lower the level of glucose, tries to get rid of the glucose through the kidneys. That's why people who have undiagnosed type 1 diabetes tend to go to the toilet a lot to pass urine. As for kidneys filter the glucose enters the blood, they also take a lot of water with it, so the person with diabetes will get very thirsty. The urine contains a lot of glucose, and that creates an environment where it's quite safe for bacteria to thrive, so it is also quite common to get thrush or genital itching. In the same way, the blood contains the high level of glucose as well, so more bacteria than usual will tend to breed in flesh wounds and make this slow to heal. Glucose can also build up in the lens of the front of the eye, causing the liquid in the lens to become cloudy. That could mean that some people with undiagnosed type 1 diabetes can have blurred vision because the
So
glucose...
this is the complication of diabetic. If you if any patient is diabetic and they does not control the blood glucose level, then chance of develop eye problem like blurring of vision or retinopathy. Sometimes they causes the kidney problem called nephropathy. Sometimes they have a nervous system problem is called neuropathy, right? Pathy means pathology, and pathology means disease. So kidney, uncontrolled blood sugar, or if anybody has a diabetic and it is not controlled, the chance of develop eye problem, chance of develop kidney problem, chance of develop peripheral nervous system problem, and this is called retinopathy, nephropathy, and neuropathy. NCLEX would sometimes ask which one not causes by uncontrolled diabetes mellitus. Uncontrolled diabetes mellitus causes neuropathy, nephropathy, retinopathy. If you get anything more than these three, this should be the answer.
Can get into the cells to be used for energy. Some bodies get undiagnosed type 1 diabetes is they start feeling very tired, lethargic, and unable to go back to their original
So due to
routine.
that sign and symptom of that diabetes mellitus, very important for NCLEX board.
But the body still needs energy source in order to work properly. So what it does is it starts to break down its fat stores, and that can lead to weight loss. So the main symptoms of type 1 diabetes are going to the toilet a lot, thirst, thirst, or general itching, slow healing of wounds, blurred vision, tiredness, and weight loss.
So
These
the sign and symptom of the diabetes, first of all, weight loss, polyuria, too much pee, so urination, right? And also patient feel dyspnea, thirstiness, and also tired. They feel tired because glucose produce the energy, but your body does not metabolize the glucose, so your body does not utilize the energy, and so you feel tired, right? If your blood sugar is not under your control, they lead to also more problem like blur of vision, like slow healing any kind of wound, or thrush, develop easily thrush, or genital itchy, right?
symptoms generally happen quite quickly, often off for a few weeks, and can be reversed once the diabetes is treated with insulin. Type 2 diabetes accounts for about 85% of all cases in the population. It is most common in the age over 50, in white population, and the over 25's age group in Black and South Asian population. Type 2 diabetes is a little more complex because of slightly more processes at work. Either the body isn't producing quite enough insulin, or the insulin still producing isn't working properly. That can lead to becoming overweight because of the buildup of fat can stop insulin doing its job properly, but can also happen in people with a healthy weight. So in type 2 diabetes, the carbohydrate containing food is broken down into glucose, and the stomach and digestive system is normal. That glucose then moves into the bloodstream. The pancreas starts to produce insulin, which moves with the glucose through the bloodstream to all the body cells, which needs glucose for energy. However, the glucose can always get into the cells because the locks of cell doors have become fed up with fat deposits. That means that the insulin can open the cell doors properly, so the level of glucose in the blood continues to rise. In response to this, The pancreas produces even more insulin, so the blood glucose level continues to rise as the insulin level continues to rise. This situation is further complicated by cells who are desperate for energy, sending out emergency signals to the liver to release stored glucose. The blood glucose level goes up, and the pancreas produces more and more insulin until it can cope anymore. Eventually, it wears out. As with the type 1 diabetes, the symptoms of type 2 diabetes are frequent urination, thirst, thrush or gentle itching, slow healing of wounds, blurred vision, tiredness, and weight loss in some people. The symptoms of type 2 diabetes come along very slowly, and some people don't have any symptoms at all. So, for that reason, the people with type 2 diabetes can live up to 10 years before they realize that they have it. Type 2 diabetes come between a number of ways. Initially, it may be sufficient to make changes to the food you're eating and to take extra physical activity or lose any weight that may be appropriate. But type 2 diabetes is a progressive condition, and most people will need some form of medication to treat it.
The last is the gonads, the ovaries, and the testes.
The gonads, testes in males and ovaries in females, are important endocrine organs, producing steroid hormones that affects growth and development, as well as regulating reproductive cycles and behaviors. There are three major categories of gonadal steroids: androgens, estrogens, and progestins. Both males and females have all three types, but in different proportions. The testes primarily secrete androgens, the most important being testosterone. Androgens are generally involved in development and maintenance of the male reproductive system. Early in embryonic development, the presence or absence of androgens determine the sex of an individual. At present, a male develops, and in its absence, a girl. Later, during puberty, higher concentrations of androgens initiate.
So you see, the testis is a gland contain the testosterone, and testosterone make a man is man. So testosterone is a sex hormone. It is the important for men's secondary sexual character. Definitely the primary major function, but also the secondary sexual character. If a man or puberty, the testis not working or testis you remove, then they should be converted to the opposite sex, right? Same thing for ovaries, secrete the female hormones or progesterone or estrogen.
The development of human males' secondary sexual characteristics, such as facial hair, increased musculature, then deeper voice. The ovaries primarily secretes estrogen and progesterone. Like an androgens in males, estrogen and progesterone.
Ovaries secretes two hormones, the estrogen and progesterone. These are female hormones.
In females are largely involved in the development and maintenance of the female reproductive system. As increased levels of estrogens and progesterone began to circulate in females during puberty, they cause the development of secondary sexual characteristics, such as enlarged breasts, widening of hips, increased subcutaneous fat, development of the uterus, initiation of the menstrual cycle.
So in this portion explaining the second part of the sexual hormones, right? So